March is Brain Injury Awareness Month. According to the CDC, about 166 Americans die every day from TBI-related injuries. Well, joining us now with more is neurosurgeon Dr. Bekelis, the chairman of Neurointerventional Services at Catholic Health. Thanks for joining us.
Thank you, Colleen.
You know, according to the statistics, about nearly 1.5 million people every year suffer from some sort of TBI. And it is it's any injury that affects the brain, right?
That's correct. And, it can be traumatic brain injury, meaning, some sort of trauma that results in injury to the brain and the spinal cord, or it can be something like a stroke or a bleed in the brain that can have a catastrophic impact on somebody. So there's multiple different ways that our brain can be affected. And most of the times it's sudden, it's immediate, and it has catastrophic consequences.
As you're saying, it can range from a mild concussion to something more severe, and the causes are vast. I mean, it can be from falling, an accident, sports.
Right, that's right. For traumatic brain injury, it's very common. It can happen from, as you said, small accidents, or sometimes even something more significant like motor vehicle crashes. But certainly, even when we don't have an immediate anatomic problem in the brain, we can have concussions, which can have a lasting impact on the brain and very lasting symptomatology.
You know, the recent death of comedian Bob Saget really shocked a lot of people, and I'm wondering, in your field, is it raising more awareness about brain injuries?
Absolutely. There's a lot of stuff out there about brain injuries, and I think more and more over the years with incidences like that, which are obviously not pleasant, but at least contribute to generalized public awareness. The general public has been aware more and more, and also through organizations such as the NFL, awareness has been raised most recently for mild traumatic brain injury all the way to severe brain injury, which is exactly what you're describing.
Yeah, so for so many years, especially in sports, nobody was paying attention to concussions, and now obviously they are. If someone does hit their head, tell me what they have to be worried about. When is it that you say, okay, I need to go see a doctor?
So, obviously there's hitting your head is a common incident, and so there's a couple of things that make us more worried. Loss of consciousness is very important. If somebody loses consciousness in and or around the time of the episode, persistent headache that doesn't resolve, neurologic symptoms that indicate some sort of stroke-like symptoms, meaning inability to speak, weakness, numbness, issues of that nature, confusion. These are indications that you should seek immediate medical attention. Also, for people that are on blood thinners, even small bumps on the head can have catastrophic consequences. So these people should also talk to their primary care provider or go to the emergency room if more serious symptoms arise.
Right. As family members, urge our loved ones to go to the doctors, even if they don't want to, or there's a hesitation there. Is there a connection between head injuries and stroke?
That's a good question. Generally speaking, no, they're two distinct pathologies, but it can coexist. You can develop strokes because of trauma, but generally speaking, strokes are a bit of a different animal, and they have to do with the blockage of a blood vessel that leads into the brain, and therefore the brain is starving from oxygen and nutrients, and that part of the brain dies, and as a result, you develop weakness, numbness, inability to speak, and so strokes are painless generally, and they happen out of the blue. And the most important thing when it comes to stroke is early identification that can save a life and change the outcome from permanent disability to back to normal.
I recently talked to somebody who just didn't feel right. Something just didn't feel right. She was on the phone with somebody else who happened to be a PA and said, well, we'll try to lift your arm. And that person could not. So had no idea that they were having a stroke at that time.
Right, and that's the most important thing, identification. And a lot of people, either because of their age or because they think it's not going to happen to them, they tend to brush off symptoms like that. But the truth of the matter is that identifying a stroke is key. And so the American Heart Association has come up with an acronym to allow for early stroke identification. And that acronym is FAST. The initials stand for face, arm, speech. It's time to call 911. And so if any of the above is problematic, then they should get immediate medical attention.
You know, as I just said, it's Awareness Month, and you're the expert. What are some of the, I guess, the main thing we should be aware of when we, possibly think we have a brain injury, or we were just talking about stroke, which, that they're not connected, but it's still like knowing when to seek help.
Yeah, so in any event, I think the FAST acronym that obviously applies to stroke applies to pretty much all neurologic injuries and all neurologic compromise. And so if somebody cannot talk, cannot move their arm, or has numbness, any sort of neurologic complaint, it's not something that we should wait on. We should absolutely seek immediate medical attention. The quicker we get medical attention, the higher the chance of having a good outcome. Neurologic disease is very much time dependent, and the more aggressive we are about identifying it and treating it, the higher the chance that the person will do okay.
Okay, so let's remember FAST. Get fast treatment if you need it. Dr. Bekelis, thanks so much for joining us.
You're very welcome.